All right, guys, welcome to Wellness Radio. I am your health expert, Dr. Nathan Warren. And so today I've got a great show lined up for you. I'm going to be going over some information that I think could take your health to the next level. Just like always, I want to make sure that the bottom line thing that we do on this show is to help you take control of your health, right? Because at the end of the day, when we're deciding, whether we want to be healthy moving forward or, whether we want to be like everybody else, sick, suffering, dying, worrying about, again, do I have enough money for my family to put me into a nursing home one day? Do I have enough money for my family to put me in assisted living? What does the end of my life look like? I want to make sure that we're looking at it from a different perspective. So again, if this is your first time tuning into Wellness Radio, I'm super excited that you're here. I hope that you come into this show with an open mind, with an open heart, ready to take your health to the next level. And again, if you are, here in Chattanooga locally and you're where we are, come check us out at our office. We are located in the Hamilton Place area, right across from the YMCA next to the Home Depot. And there we see, kids of all ages, adults of all ages, whether they're pain patients dealing with neck pain, back pain, headaches, or whether, it's somebody that just wants to optimize their health and wants to, maybe work on optimizing thyroid function or working on, healing the gut or working on, reducing autoimmune symptoms or work on, making sure that they're not going to worry about a heart attack in the future or cancer in the future, really working to heal the body and prevent. And yes, I even use the words heart disease and cancer because yes, those are preventable. And I know every now and then I'll get somebody who's like, oh, no, Dr. Nathan, but you don't understand. Like my family member had, this type of cancer and it was genetic. And well, yes, I understand that there may be a component, 2 to 6% of cancers may have a genetic component to it. But I also know that it is the environment that influences whether genes are turned on or turned off, right? Or a better way to say it is whether genes are expressed or not expressed. It is the environment that it's in. So whether it's the internal environment or the external environment, again, these things, if you do the appropriate steps, again, it gives you the best chance at preventing these diseases, right? And that's what we want to do, again, is we want to approach health from a different perspective. We live in a country right now that literally relies on, cutting, poisoning, and burning ourselves to quote unquote health. And that doesn't work. It just never does. When somebody comes in, they're like, Dr. Nathan, I had cancer, I had chemotherapy, I had radiation, it saved my life. I always stop and I don't care who it is, but I take a moment and let them know that no. It was not the chemotherapy and radiation that saved your life at all. Actually, it was your body that was turning over cells and repairing itself fast enough, right, to be able to recover from the treatment that you just were given. And once they understand that, oh yeah, that's right, like, chemotherapy and radiation, there are some times where maybe that has a place, but again, the purpose of those are to kill bad cells, right? But they're also killing good cells. So how does your body heal? Your body heals by producing its own, right, reparative mechanisms to, again, heal the body overall. So that being said, different mindset, right? We have to change our mindset about what health is and where it comes from, and it comes from the inside out. And so, again, the best doctor, like we always say it lies within you. You are your own best doctor, which may be kind of different than what you've ever heard a doctor tell you before. But Dr. Rebecca and I, we truly believe that. So we encourage our patients to do research. We encourage our patients to look, to go online and look for resources. There's all this major discouragement with Dr. Google. And I'm like, are you kidding me? Most of your medical doctors, when they prescribe their medication, are probably looking on Google as well. They don't know what they're talking about. They're just, prescribing something that the pharmaceutical rep came in, brought them lunch and said, hey, this is the best new drug for rheumatoid arthritis. You should all take it. And so again, I encourage you guys to do your own research, to read your own books, to actually build up a wealth of knowledge so that you can be a warrior for yourself and for your family. There is no doubt about it. So I've got a great show lined up for you today. So I'm going to be going over, just to go over some of the topics, we're going to be going over how to actually reverse things like fatty liver, right? Because non-alcoholic fatty liver disease seems to be just rampant nowadays. So again, we're finding that people have, elevated, liver enzymes, having things like their liver markers being elevated. And so again, getting this diagnosis of, fatty liver disease or non-alcoholic fatty liver disease seems to be something that we're seeing this major trend for. And I'm going to go over what are the proper steps to take to actually reverse something like fatty liver disease. And yes, I use the word reversal. I know people get, super, crazy scared about the word reversal. For some reason, you get giddy about it. But, again, that's just the bottom line. Now, I don't treat fatty liver disease in my office, but we help people change lifestyle in order to allow their bodies to heal the way that it should. The other things that we're going to be going over as well is healing heartburn, right? How do we get rid of heartburn? Why do we even want to get rid of heartburn? Why is the medication that you're taking actually, increasing your risk of even worse disease later on, and again, worse outcomes later on? So we're going to go over, kind of dive into that a little bit, that I think is super important in order for you guys to reach, the goals that you want to reach. So again, as we go throughout this show, if you're listening on Facebook Live, please let us know any questions that you have. Let me know any questions that you may have or that your family member may have. Maybe they're suffering with heartburn, or maybe they have issues with the liver. Again, let us know so that we can dive into that, in depth, especially even during the commercials. I still, continue to talk about, about our health topic live here on Facebook. So, and if you like the topic, or if you have family members or friends or people that need to hear about, how to do some things to reverse heartburn, how to do some things to reverse fatty liver, share it. So like and share it so that, again, we can get this word out there and get people, really out of their medical doctor's offices as much as we possibly can, except for emergency situations. That's really what we want. So again, guys, when we dive into something like fatty liver disease, this is important to recognize that we are seeing this absolutely skyrocket, across our country, and really in my clinic alone. I would say that for my patients over the age of, 45, I would say about, 3 out of 10 that come in have some issues with the liver as far as like non-alcoholic fatty liver disease. And there's a reason for that. So where I practice in my clinic in Chattanooga, we actually have, or at least for a while, we were top 10 in the United States of America for our diabetes rate. So top 10, we were actually top 10 in juvenile diabetes rates as well. So diabetes is rampant. And here's what we know about something like non-alcoholic fatty liver disease. You ready for this? One of the easiest ways to reverse non-alcoholic fatty liver disease is to heal your body metabolically and actually decrease the amount of carbohydrates that are coming into your body. So heal the body metabolically. So how do we do that? That means drastically and radically changing our diet. And then we're going to do some different herbal supports and vitamin and mineral supports for the liver. So the primary mechanism for getting rid of non-alcoholic fatty liver disease is to actually get somebody on a really good nutrient-dense ketogenic diet, all right? And so what we're seeing is because of the rates of not only diabetes, but pre-diabetes, actually an estimated 85 million Americans are walking around with pre-diabetes. That means they don't even realize it's happening. And trust me, that's easy to do. Some of you may be like, how do you not know that you have pre-diabetes? Well, I'll tell you how. Because the majority of people that come into my clinic, they're getting their blood work maybe once a year. That's if they're seeing a physician. And most of that blood work is absolutely incomplete. It's just bare minimum of what their insurance is going to cover. So absolutely bare minimum. Yes, I even have patients that bring me blood work, their yearly, quote unquote, yearly checkup, that don't even have their A1C on it, right? The 3-month average of their blood glucose. We don't even get to see that, which is just absolutely mind-blowing. And so, again, we know that there are definitely ways that we're going to see people that have pre-diabetes that go years before they're then diagnosed with diabetes, and then they're actually given a treatment. We even have people that go into their doctor, they're like, oh yeah, you're actually borderline, you're kind of pre-diabetic. So, next year when you come back, you'll probably be full-blown diabetes, then we can actually treat it. And it's like, holy crap, guys. Are we serious? We have to get down to the root cause and realize that if you're pre-diabetic or diabetic, you are destroying your body. You are damaging your cells. You are damaging your hormone receptors. You are absolutely wreaking havoc on your mitochondria. And some people may say, well, yeah, but I'm taking metformin and so my blood sugar stays stable. That's called managing. That's not called getting to root cause, all right? And managing always leads to what? How many people do you know? They get on metformin and then they're like, oh, you know what? Like, you're doing so well, you're able to come off of it now. You're doing great without making lifestyle changes. You see what I'm saying? Again, nobody takes metformin and your pre-diabetes or your diabetes goes away. You have to change your lifestyle in order to get that to go away. And by doing that, if you have non-alcoholic fatty liver disease, then you can absolutely help the liver to heal. And so the liver is actually one of the organs that we know for an absolute fact is regenerative. It is a regenerative organ. That is why some people that do things like, for example, like, again, giving pieces of their liver maybe to whether it's a family member or somebody like that that they need, because it's a regenerative organ. It's absolutely fantastic. So for those of you that are dealing with non-alcoholic fatty liver disease, or your liver enzymes are high, or you're having liver issues, again, recognize that you can do something about it, right? That you absolutely can make some major changes in your lifestyle and see phenomenal results with it. What are some other ways that you know if the liver may not be quite working the way it should? Well, let me give you some examples. Maybe you have skin issues. So as you age, maybe you see those, well, quote unquote, age spots, right? Or some of them may call liver spots, where you see them kind of popping up. The darker colored, spots on the skin is a good sign that, hey, you need to do some work on your liver. Maybe you have an issue with your thyroid. So if you have a conversion issue with your thyroid, guess what? You got to do some work on the liver. Maybe you have an issue with, your overall digestive system. Maybe you're somebody who suffered with some type of autoimmune digestive problem, or maybe you're suffered with, constant going back and forth between constipation, diarrhea, or maybe you don't digest your food appropriately. Guess what? You've got a liver issue. We need to make sure that we're working on that. Maybe you're somebody that is constantly having skin issues like eczema, and that continuously pops up at different seasons. Guess what? You need to work on that. Maybe you're somebody that consistently has low vitamin D levels despite you trying to supplement with vitamin D and getting sunshine. Guess what? We may need to work on the liver to see improvements there. So again, those are just some examples of people that have issues with the liver. So we're going to dive into kind of the step-by-step, process that it takes to start reversing non-alcoholic fatty liver disease. Again, lifestyle based. So I'm going to take a quick break here on our radio show on Wellness Radio. If you want an appointment with either myself or Dr. Rebecca in our office and you're local to Chattanooga, or you just don't live that far away, because we do have people that come from Knoxville and Atlanta and Nashville and Franklin and places like that to see us in our clinic. If you want to come and see us in our clinic, you can actually give Mary Beth a call. She is standing by. That number is 423-362-5360. Again, that's 423-362-5360. Or you can go online. You can go to our website, doctorswarren.com, DRSWARREN.com, and you can check us out there. You can read more about us. You can get to know us a little bit. Also, too, maybe you live somewhere else. Maybe you're in California, or you're in Texas, or you're in Oregon, or you're in, Massachusetts, wherever you're at. If you want an appointment to see us there, we can also do a virtual appointment as well. We've been doing that for years now, way before COVID, way before the trend of virtual medicine. We've been doing that for a while. And again, they can get you set up with that, Mary Beth can, or you can schedule that also on our website, doctorswarren.com. So this is Wellness Radio with Dr. Nathan Warren. I'll be right back after the break. All right, there we go. All right, guys. So non-alcoholic fatty liver disease. This is one that again, I thought would be really, really good to talk about, mainly because I'm seeing this over and over again. Anytime I get blood work, if it has any type of liver markers, I'm usually seeing it on there, especially for people that are over the age of 40. I didn't mention this. Another reason to work on the liver is if you are somebody that has had hormone imbalance. So maybe you're a woman that even in the past has had like a hysterectomy. Maybe you're somebody that suffered with like PCOS. Maybe you're a man that's had low testosterone issues, or just imbalance overall. Maybe you're somebody that's kind of burned the candle at both ends, and you're, wired and tired at night and you're exhausted in the morning. Guess what? There's going to be some liver components to that we really want to make sure that we're working on. Maybe you're somebody that suffered with things like parasites in the past. Guess what? Got to make sure that we're working on the liver as well too. So we really want to make sure that, overall, when you look at the health of the overall body, if the liver is not functioning appropriately, guess what? You are not going to be functioning appropriately. You are going to have health issues. So think about the number one thing. And I guess I shouldn't say number one, but it's got to be at least up there. One of the number one processes of the liver and what it does is actually producing glutathione. And glutathione or glutathione, whatever you want to call it, but glutathione is the most powerful antioxidant that we know of. And it is produced in your liver. And so the more issues that you have with your liver, the more issues you're going to have with producing glutathione. And glutathione is one of those that actually works on it's a part of the process of detoxification. It's a part of the process of your immune system and the way that you're able to fight off things like bacteria and viral infections. It's a big part of, how well you're able to kill off cancer cells on a regular basis. So glutathione is absolutely necessary, and it's being depleted over and over and over again in our society because of, the air that we breathe. We know environmental toxins absolutely nail our glutathione levels. If you live anywhere near, for example, like California, where all the wildfires are going nuts, and plus with the pollution alone, if you lived anywhere near that, guess what? Your glutathione levels are in the tank. So you need to make sure that you're taking care of that. Maybe you live in New York, near a major city. Maybe you live in Atlanta, wherever you're at. If you live, anywhere near a city, guess what? Your glutathione levels are probably getting hit pretty hard on a regular basis. But those of you in rural areas or in the country, you're not exempt from this as well. If you're constantly being exposed to herbicides and pesticides and glyphosate and those type of things that are being sprayed or put in the water or again in the food that you may be consuming, guess what? Your glutathione levels are going to be in the tank. So we want to make sure that we're taking care of the liver as far as our glutathione levels go. So we're about to go live here in just a second, and as we do, I'm going to give you solutions on how to take care of your glutathione levels and what are some of the best ways to bring that up. All right, guys, welcome back to Wellness Radio. I am your health expert, Dr. Nathan Warren. I'm going to be going over today fatty liver disease, right? Non-alcoholic fatty liver disease. What are some of the most important steps you can take to start reversing that today? And then we're going to dive into later in the show, how to reverse things like heartburn, what to look for, what are some of the most important things to actually look for when taking the step to reverse heartburn, which I think is very, very important. So, now, when we're looking at fatty liver disease, we talked about how, number one, we have to change our diet, right? We absolutely have to. You are not going to reverse fatty liver disease if you are still consuming a lot of carbohydrates on a regular basis. It's just not going to happen nearly as fast. You need to make sure that you are cutting down your carbohydrate load. So doing a nutrient-dense ketogenic diet, that's not just bacon and butter and cheese. I'm talking about actually a nutrient-dense one. So maybe for breakfast, which again, you should be intermittent fasting. Maybe I should start there. Your first step in reversing non-alcoholic fatty liver disease is intermittent fast, right? Actually start implementing intermittent fasting. I would really like you to hit around the 16 to 18 hour mark of intermittent fasting. And some people are like, wow, that's really hard at the beginning. Well, guess what? you got non-alcoholic fatty liver disease. You're gonna have to push yourself a little bit. You're going to have to make some of the uncomfortable changes if you want to not only survive, but if you want to thrive through life. So again, I want you to intermittent fast 16 to 18 hours. I want you to really hit that window. Then for your first meal of the day, what does it look like on a nutrient-dense ketogenic diet? Maybe you're going to have something like pasture-raised eggs that you get from, a local farmer or local health food store. And then you can have that. Maybe you're going to eat something like organic chicken sausage with a side of, something like avocado, right? That would be a really great way to start your day. Or maybe you're going to make an omelet that's got pasture-raised eggs and some really good vegetables in it. Maybe you throw some broccoli in there or some broccoli sprouts. Maybe you throw, some raw goat cheese in there if you like some cheese. Maybe you're going to throw some onions, some garlic, some chives, things like that, and make yourself an omelet. Or a third option, maybe you make yourself a big smoothie or a big shake using something like full-fat, unsweetened coconut milk, or my favorite, macadamia milk that's unsweetened. Throw in some frozen blueberries because they're lower glycemic, but loaded with tons of antioxidants, tons of polyphenols, and so you can throw those in there. I like wild blueberries the best, just because when you're looking at wild blueberries, they actually contain high amounts of actual substance and plant power that actually helps to increase what's called BDNF, brain-derived neurotropic factor, and increase the amount that your body is turning over brain cells and actually healing the brain. So I really, really love wild blueberries. So throw, maybe it's a half a cup of wild blueberries into full-fat coconut milk, or my favorite, again, unsweetened macadamia milk. Then you can throw some good fat in there, right? So what would you throw in there? Something like MCT oil is fantastic. We use bulletproof MCT oil. Why do I use that? Because number one, I think Dave Asprey is brilliant, and I've been reading his stuff, following his stuff literally for years, way before it was really cool. But again, he was kind of on that cutting edge of saying, hey, you know what? These MCTs are going to be a powerful tool to actually help your liver and help your body produce ketones. So MCT oil, you can use things like, I like to use raw cold pressed oils as well. So you guys have heard me, if you've listened to our show before, I like to use things like Andrea's seed oils. If you go on our website, doctorswarren.com, and you look at the shop, if you scroll down towards the bottom of the page, you can actually see Andrea's seed oils. You can get a discount, again, if you order those, but they're raw and they're cold pressed, right? Which, if you're going to consume something like flaxseed oil, it absolutely has to be raw and cold pressed. If oxygen hits it, if it heats up at all, again, it damages that precious fat. Same thing with, whether it's raw, cold pressed, unfiltered sunflower seed oil. Again, these are omega-3 and omega-6s that are so powerful to healing the cell membranes and increasing your insulin sensitivity. So add in those good healthy fats into your shake. You can even throw something like, maybe it's organic olive oil in there. Maybe it's something like, some cold press organic avocado oil, but throw in those good healthy fats into that smoothie. Maybe you want to say, hey, you know what? Instead of an oil, I'm going to throw in a piece of avocado into my smoothie, kind of makes it kind of creamy. You can do that as well. Then add in your favorite type of protein powder. I love a collagen protein powder, just because of all the amazing amino acids and the healing properties that are great for your joints, as well as great for your gut health. And I believe that collagen, we are so deficient in it in our society. And so again, get that into your shake or smoothie in the morning. Just put, 1 or 2 scoops in there. And again, I like looking at something, the one we use at home, Ancient Nutrition. Mine tastes like brownies, absolutely fantastic, but it's sweetened with monk fruit and stevia. So again, it's not going to spike my blood glucose and my insulin, The other thing I like to throw into mine, I throw some greens powder into mine. So I'm getting some really nutrient-dense greens that are actually already broken down for my digestive system, which, guess what? It makes it easier on my digestive system to bring it into the body and to assimilate and utilize all those fantastic nutrients. And there's many different greens powders out there that you guys can use. Choose one that, again, you enjoy the taste of, plus that has really, really great ingredients in it, that has no sugar in it, that again, if it's sweetened with something like monk fruit, or it's sweetened with stevia. And so that could be a shake that you do in the more after your intermittent fasting. So I gave you guys 3 different options there for breakfast. And so if if maybe you're like, hey, I'm one of those that I don't really like to think about, what to do for my meals. We'll go back and listen to that again and write those down and just rotate those 3 that I just talked about and consume those on a regular basis. We want, for that first meal of the day, we want primarily good fat and protein. Very little carbohydrates for your first meal of the day when we're trying to reverse fatty liver disease, okay? Now, you can then choose, hey, in my feeding window, right? So if my fasting window is 16 to 18 hours, and then my feeding window is going to be, maybe 6 to 8 hours, you have to decide, am I going to eat just 2 meals or am I going to eat 3 meals during that time? What I would tell you, unless you're like hardcore working out, maybe 2 meals is the way to go. If you are somebody who's like really hitting it hard at the gym, or maybe you're just somebody who's very, very active, maybe you want to throw in 3 meals during that time. But here's what you don't want to do. You do not want to snack the entire time throughout that feeding window. That's where people make their mistake. Because even if your feeding window is 6 to 8 hours, we still don't want to see your blood glucose and insulin go up and down, like you're watching like an EKG or something. We want to see it like literally. We want to see, like if you're panicking on an EKG, I guess I should say, rather than a regular one. We want to see, again, maybe a slight, blood glucose and insulin spike followed by kind of a slow release, so more of like a hill rather than like a really sharp mountain as far as your blood glucose and insulin goes. So second meal of the day or third meal of the day, you can kind of do it how you want. I always recommend, you're choosing a really good, healthy, whether it's pasture raised or wild caught meat or seafood, as a part of your lunch or dinner. And so again, switch that up, right? There's different, benefits to different types of good quality animal products, right? So things like maybe it's grass-fed, maybe it's bison, maybe it's grass-fed lamb, maybe it's something like, maybe it's venison. Maybe you're a hunter and you went out and you killed, a deer. So maybe it's venison. Maybe it's grass-fed, grass-finished beef from a local farmer. Maybe it is something like pasture-raised chicken, or maybe it's something like, wild-caught fish and seafood. Whatever it is, choose one of those, right? And that's going to be a part of your dinner. And then choose one of the following, right? So I would choose something like a cruciferous vegetable. So maybe it's cauliflower or broccoli or Brussels sprouts, or maybe even, kale that's been sauteed or cooked. I would cook those, right, in some fashion or form and add really good healthy fat to it. So maybe it's broccoli that you add olive oil and grass-fed butter to it. Maybe squeeze a little bit of lemon juice and sea salt on there, and that's one of your sides. For my other side, I would also do some type of leafy green vegetable. So maybe you're going to choose something like, again, spinach is great. Or maybe it's like, you can see at the grocery store, like Power Greens. It's got all different types of like little microgreens in it. Whatever it is for you, maybe it's sprouts. But again, choose a green kind of leafy vegetable that's super nutrient dense. And then you can put some good healthy fat on there. For dressing, use something like Primal Kitchen is a great company that again has, all kinds of different like keto dressings and sauces that are made with really high quality ingredients. So you can throw some of that on there. And that's your dinner or your lunch. And you can just repeat that, right? For lunch and for dinner if you're doing 3 meals during the day. And so that right there is a perfect example. I just laid out for you a perfect example of what it would look like on like a diet where you're trying to reverse something like non-alcoholic fatty liver disease. And I think that that's like your first step in the process of healing the liver. Now, one of the questions I get asked all the time is, well, Dr. Nathan, how long should I be doing something like a nutrient-dense ketogenic diet? And my answer to that is as long as it takes to see your blood glucose and insulin, seeing that be consistent and low and lower than you've ever seen it before. That's my answer to that. So for some of you, it may take, a good, 90 days. For others, it may take a good 6 to 9 months. So again, be consistent with it. Oh, Dr. Nate, what am I going to do for Thanksgiving? What am I going to do for Christmas? Well, listen, if your life is more important than what are you going to do on a couple days, you're going to still stick to that even at Thanksgiving and Christmas. And actually, again, that's actually easier than ever to do in today's world with all these different companies that are producing desserts and snacks and all these great things that are still, whole food based and ketogenic and lower carbohydrate all at the same time. So I gave you guys a perfect example there of what a diet looks like. When we get back, I'm going to go over, as far as supplementation goes, what are the primary things to focus on for non-alcoholic fatty liver disease or just optimizing the liver in general. I'm going to go over those things when we get back from the break. So again, guys, if you want to come and see us in the office, if you want to see Dr. Rebecca or myself, you can give Mary Beth a call. That number is 423-362-5360. Again, that's 423-362-5360. And you can come and see us in person. We can do that appointment and really start to break down what's the root cause of your health issues or how to optimize your health. Or number two, if you live somewhere else, or if you just feel more comfortable doing a virtual appointment, Dr. Rebecca and I both do those as well via Zoom. We've been doing it for years now. We have a whole virtual practice that we work with. So again, we can do that as well. You can let them know either same number, 423-362-5360, or go to doctorswarren.com, DRSWARREN.com, and it actually breaks it down, what it looks like to be a virtual client of ours and kind of do that via online as well. And you can see the whole process there at our website. So again, guys, this is Wellness Radio with Dr. Nathan Warren. I'll be right back after the break. All right, guys, so hopefully that helped. I think sometimes when I talk about, hey, here's what I want you to do as far as a ketogenic, like nutrient-dense ketogenic diet, hopefully that helped kind of breaking it down for you so that you can see, what it looks like. Now, I'll give you a tip. One of the things that I did when I was changing my diet is I went down and I made a list. So I made a list, and then I stuck it on my refrigerator, but I made a list of my favorite meats. I made a list of my favorite cruciferous vegetables, my favorite leafy greens, and then I also made a list of my favorite sauces and my favorite desserts. And then what I did is I would go throughout the week and I would kind of circle, right, which ones I was going to do for each meal. So I would circle those just to make it easy, and then I would go to the grocery store. Now, for me, it didn't tell me hey, put this exact tablespoon or teaspoon of this in it, or, this is how many ounces of meat to buy. That was kind of overwhelming for me. So I just wanted a kind of a general idea of these are the things that I enjoy. This is how I can pair my different meals so I don't get bored with it. And I would just go through that list and I would pick it out. And guess what? If I went out to eat with friends and family, or if I, was hanging out, I still went by that list. And guess what? No matter where you go, I mean, you could literally go to, I know it's not going to be the highest quality, but let's say your family is, you're traveling and your family wants to go to Chick-fil-A. Okay, well, you know what? Yes, the chicken's probably not going to be the highest quality at all, but guess what you can do? Maybe you choose I'm going to get grilled chicken and I'm going to get a salad. I'm going to skip the dressing. Maybe I bring my own olive oil and sea salt with me and put that on there. And guess what? There you go. You just had meat, you had vegetables. So again, yeah, maybe not the most nutrient dense. Yeah, I don't usually condone eating conventional meat, but it's a lot better than loading your body with damaging tons of carbohydrates that are going to literally spike your blood glucose and damage your liver even further. So again, make those decisions no matter where you go. So maybe you're one of those people that needs to make that list and then kind of break it down for yourself and say, okay, this is the meat I'm having, this is the vegetables that I'm having, this is cruciferous vegetables that I'm having. Hey, here's even some of the desserts that I'm going to have. And yes, you can have some amazing desserts eating lower carbohydrate, eating ketogenic diet as well. I'll give you some examples of companies that are out there where you can get some of these types of desserts and enjoy them and feel great, at the same time. Yes, you can make these as well. So listen, judge time versus money. If you're one of those that needs to really, prioritize money, then guess what? You're going to want to make some of your ketogenic desserts, and really some good websites. Look at, I think we have some recipes on our website, but you can also look at like bulletproof recipes, online. Go to bulletproof.com. That's a great one where you can check out a lot of nutrient dense, high fat, good quality desserts there, and really kind of see some good ones that you can make at home. But if you are one of those that time is your biggest value, and again, you're willing to spend a little bit of extra money to get some of those things, well, you can look at like companies, for example, like Swerve and Lakanto. Those are great companies where you can actually make some of your own desserts that come like kind of pre-packaged. So like maybe you're one of those that like, listen, Dr. Nathan, I love what you're talking about, but I also love brownies and I want to have brownies. Well, guess what? You can have both now. So, you can look at something like Swerve or Lakanto, get kind of their pre-mixed brownies, and you can make those and maybe add some extra fat into those, and again, make those super nutrient dense. Another really cool thing that you can do with your desserts that I really like to do with my kids, and we do with ours as well at home, like let's say I'm gonna make something like some Lakanto brownies or something. I will add in some spore probiotics into those, which are in a protective form that actually are able to withstand heat, right? Up to about 475, 500 degrees. And so you can actually break open a capsule of like spore form probiotics, and there you go. You just made a really nutrient dense, loaded with good microorganisms, and you can enjoy your brownies all at the same time. All right, guys, welcome back to Wellness Radio. I'm your health expert, Dr. Nathan Warren. I've been going over how to reverse non-alcoholic fatty liver disease, all right? So I went over diet-wise, kind of what to do, how to break it down, and really how to kind of stay within that realm. Also, if you missed it on Facebook Live, you better go back and watch it. I talked about some of my favorite, dessert companies. I think that you can have, you can eat a really nutrient-dense ketogenic diet, and you can have some of the desserts that you want as well at the same time, that are lower glycemic, that are sweetened with things like monk fruit or stevia, or even something like erythritol, and really kind of hitting that realm right there, so you're not spiking your blood glucose and insulin. Now, let's go over supplementation, because I do think that this is an important part of working on the liver. So one of the first things that I will kind of do, maybe as somebody's changing their diet, is I'm going to figure out how can I support their overall production of glutathione. Now, glutathione is what the master antioxidant that's produced in the liver, but it's not just as easy as saying, hey, you know what, I'm going to pop a capsule of glutathione and see my glutathione levels go up. Actually, it's not very well absorbed from a supplementation standpoint. So we have to figure out unique ways to either help the liver to produce its own glutathione, or unique ways to actually, if you're going to supplement with glutathione, how to get it into your body and into your bloodstream really efficiently and as fast as we possibly can. So when somebody's just getting started, I like to use something called G-Cell, G-C-E-L. G-Cell. It's by a company called Systemic Formulas. It's on our website. If you go to doctorswarren.com, you go to shop. If you go to our, that one's going to be on our Revelation Health store that's right there. You can get that one, and it's got all the components in it to help support the liver's production of glutathione. That's why I like it so much, because it's not just dumping glutathione into the body. It's saying, hey, how can we aid the liver, again, in its process to heal so that we can produce more glutathione? So it's got things like N-acetylcysteine, NAC, which I think is very, very important. N-acetylcysteine, also during this time, as you guys have heard me say before, is a very, very powerful tool to use if you have any type of like breathing issues. So if you have COPD or asthma or something like, maybe it's I don't know, other lung issues I can't even think of, bronchitis, or you're prone to getting something like pneumonia, or you're worried about just overall lung function. Again, N-acetylcysteine has been shown in clinical trials, actual peer-reviewed research in clinical trials, to do an amazing job of working on the lungs and helping, in those situations, even things like cystic fibrosis, looking at N-acetylcysteine, which is super safe to take. There's N-acetylcysteine's even been to the point where it's been studied for women who've had things like multiple miscarriages and been shown to actually help them carry a baby to term, looking at N-acetylcysteine. So N-acetylcysteine supports the liver a lot and helps. It's kind of a precursor of glutathione production. So that's in pretty high amounts in something like G-cell. Now, if you're just going to supplement with N-acetylcysteine, I recommend, especially somebody with like non-alcoholic fatty liver disease, really hitting around like 900 to 1,000 milligrams of it. And I say do that about 2 or 3 times a day to really support that process. Now, it's got other things in it like milk thistle. It's got some actual really high quality curcumin in it. It's going to have things like dandelion root, which is amazing for the liver as well. So it's got those components in it. It's got some really good B vitamins that have been shown to actually help with the and support the production of glutathione. And then it's got a little bit of glutathione, reduced glutathione in it. So again, it's going to have a little bit of that as well. So that's why I like to start somebody off with that, doing about 2 capsules 2 or 3 times a day, depending on the severity of the problem. So again, changing the diet, starting on something like G-cell. That's a really great beginning. Now, once they get into it, then we're going to dive a little bit deeper into how to actually help support liver function. So the next thing that I like to work my way into is something called the push-catch liver detox. Now, this is one by Quicksilver Scientific that I think is a very, very powerful tool to use. So the way this works is it actually has phospholipids in it and good healthy fat, and also things that support the liver, like some of the things I just went over, like N-acetylcysteine and milk thistle, along with like quercetin or quercetin, however you want to pronounce it. It's got those things in it, and DIM, like DIM as well, that are in that component that actually helps to like thin the bile, push the bile out of the liver, so kind of clearing out that hepatic duct. And then you have a binder that catches onto those toxins. So it's kind of like, think of it as you're pushing out some of that sludge and some of that junk that's in the liver, and then you're catching it with the binder. That's why it's called push-catch liver detox. That's also on our store, doctorswarren.com. It's on the Wellevate store there where you can actually get it. And again, it's very easy to do. You just follow the instructions once you get it. Now, if you're one of those who are like, nope, I like to go all the way out, then you may want to do 2 boxes within that 1 month and really hit it hard. And that's a really great way to start supporting the liver. All right. Another one that you can do that I think is important to mention, because some of you may say, well, I don't really want to go through that. I kind of want to just knock it out and as quick as I possibly can. I like using something called the Paleo Cleanse, all right? It's called the Paleo Cleanse, and it's by Designs for Health. It's something that I can see usually within a 14 to kind of 28-day marker, depending on the severity. You can actually rerun blood work and see major improvements in things like liver enzymes, seeing improvements in things like, even cholesterol numbers, like triglyceride numbers, seeing really major improvements in markers in just a 14 to 28 day period of time. So again, that's called the Paleo Cleanse by Designs for Health. That's also on our store as well. You can check that out. But these are some great ways, supplementation-wise, to really see some major improvements there in reversing something like non-alcoholic fatty liver disease. So I got to go on my last break of the show. If you guys have any questions, log on to Facebook on Doctors Warren, like and follow our page, and ask your questions on here. We can answer them during the break. As well as if you want an appointment, 423-362-5360. Mary Beth is standing by, or go check us out on doctorswarren.com. This is Wellness Radio with Dr. Nathan Warren. I'll be right back after the break. All right, guys. So that was a lot. All right, dealing with non-alcoholic fatty liver disease, or just how to optimize function of the liver. And so that hopefully that gives you some good ideas on where to start. Maybe you're just going to start with the diet first, and that's totally fine. Remember, that is a foundational principle of health. Supplements are only there to supplement a healthy diet. So if you don't even have the dietary part down yet, don't think that a supplement is going to be your magical fix, or that there's a magical pill out there. Again, supplements are there to supplement a healthy diet and lifestyle, okay? But hopefully that gives you some good ideas on where to start and what to do there as far as helping the liver, optimizing liver, and reversing non-alcoholic fatty liver disease. Now, the other thing that we were going to go into that, again, I only have a few minutes to dive into is heartburn. So I want to kind of give you guys a little greater insight than what I'll give on the radio show since you guys are listening on Facebook Live. When it comes to heartburn, it's about finding the root cause. So I think that the number one way to start with, again, with trying to, whether it's reverse heartburn or whether it's get rid of it or finding out the root cause of your heartburn, is doing a stool test. So we do what's called a GI map stool test. It's a PCR stool test. And again, it's going to be a great insight into what's going on with your gut and with your GI system. We also get to see some really good functional markers of gut function to see really, how is it working? Are you having issues with your pancreatic enzymes and breaking down like some of your protein, that you're consuming? Are you having issues with your hydrochloric acid production? Like you're not producing enough, which is one of the most common causes of heartburn, on the planet. Or are we seeing things like, maybe your immune system is down with secretory IgA. Maybe it's too high because you have an active infection going on. Maybe you have an overgrowth of H. pylori. You're able to see something like this kind of in perspective. You're able to put like a magnifying glass down on the function of the gut and really see what's going on. So I think that's step number one when it comes to finding out the root cause of heartburn issues. Now, from there, I also think it's important that you start working on the vagus nerve. All right, so vagal nerve function. So we all, the majority of people have issues with the vagus nerve, mainly because you're constantly in fight or flight mode. If your body's in fight or flight, right, where it's always under stress, the vagus nerve will, over time, it will have an effect on the vagus nerve. It will create some damage there with the vagus nerve or some dysfunction, if you will. Now, so that's why I always recommend, wherever you're at, finding you a really good structural corrective chiropractor that you can actually work on your nervous system, your spine. Again, yes, there's going to be a percentage of patients that just by doing that, by working and supporting the vagus nerve, that they see improvements in their heartburn alone. Now, that doesn't mean that it's that chiropractic treats heartburn. I'm not saying that at all. But by working on the nervous system, balancing the nervous system, supporting vagal nerve function, your body is then able to heal and function appropriately and able to see things like symptoms of heartburn start to improve. So yes, we see that a lot in our clinic, just like I'm sure, any other chiropractor out there that really practices, curve correction and working on balancing the nerve system sees a similar effect as well. So that's another step that you can take. Even as simple like WebMD search of something like heartburn, you're able to see, again, you're able to see that a primary cause could be vagal nerve issues. Now, what's some other things that really damage the vagus nerve that I find a lot? Well, if you've been taking heartburn medication, if you've been taking like a proton pump inhibitor, a PPI, or if you've been taking like some of those, popping those antacids all the time, or if you take something like an antidepressant medication, those things will have an effect on the vagus nerve. So yes, if you're taking a depression medication, you have to understand those things were only studied to be used for about a 2-week period of time, and yet we have people that have been on those things for 20, 30, 40 years, and that is absolutely unacceptable and will damage and change the brain and the body. All right, guys, welcome back to Wellness Radio. I'm in my last segment here of the Wellness Radio for this Saturday. I hope you've enjoyed the show. We've been talking all about, how to reverse something like non-alcoholic fatty liver disease, And also on Facebook Live, I started to dive into, heartburn, right? And what to do with heartburn. So that being said, I wanted to spend the last couple minutes, talking about, at least give you guys on the radio a few things that you can do from a heartburn perspective. If you need to go back on our Facebook Live, I did talk about some of the ways to start, some of the reasons behind it. So again, go to Doctors Warren on Facebook so that you can check that out and go back and watch it. Now, from a standpoint of, what are some of the solutions? Well, I always like to start small first, right? Kind of start with the most simplistic thing that you can do to see if it improves, and then kind of scale your way up depending on the severity of the problem. So for some of you, maybe you just try to stimulate some hydrochloric acid production prior to your meal. How would you do that? You can use things like apple cider vinegar, like raw, unfiltered apple cider vinegar. You can do like a tablespoon and maybe 4 to 6 ounces of water, and you're gonna drink that about 5 to 10 minutes before your meal, right? That helps stimulate hydrochloric acid production. You can also use something like bitters. So you can use actual bitters that you can get. There's places like I think it's Urban Moonshine does a really great, bitters. I know Quicksilver Scientific has great bitters that you can use. Or you can actually use bitter herbs. So like you can take some herbs, you can infuse them yourself, or you can just kind of chew on some herbs. So like, maybe chew on some of the most bitter herbs. I know like even chewing on like some rosemary, before you eat really helps to get some of that hydrochloric acid production going. And that's kind of my step one. That's a simple step to take. Step 2 is if that's not really working, maybe you need to actually supplement with something like betaine and HCl and maybe a good proper digestive enzyme, right? So supplementing with those. So you're going to take like kind of your betaine HCl like at the beginning of the meal, and then you're going to take your digestive enzymes during the meal, all right? And so that's a really great way to help break down your food and make sure that you're digesting appropriately, especially for those of you that have that reflux kind of burning like post, eating a meal. And so that's kind of your tier number 2. Your tier number 3 is you're really going to want to also use something like adaptogens to help calm the nervous system and really help also support the vagus nerve, right? So you can use things like ashwagandha, rhodiola, cordyceps, lemon balm, astragalus, American ginseng. These are all really great to help support things like not only the hypothalamus and your stress, your actual stress response, but also to help support vagal nerve tone and the vagus nerve. So those are some of the things that I would do. Now you can also do things like humming, and you can do things like singing. Those also help with the vagus nerve. Deep breathing helps with the vagus nerve as well. So those are some things steps that I would take when I was doing things like trying to improve my heartburn. So hopefully that gives you guys a good idea there. I know I had to kind of cram that in at the end, but I think it's only because we went over some really great information with non-alcoholic liver disease. So if you want more information about us, doctorswarren.com. Go check us out on our website, DRSWARREN.com, or come in and see us in the office. That number is 423-362-5360. Again, that's 423-362-5360. Come check us out in office or online. You can set that up with Mary Beth. She's standing by. And as always, go on Facebook, like and follow our page, ask us questions, be involved with us. We're trying to create community in a world that's so isolated and separated, and in a one kind of movement goal towards health and optimizing the health of your body and your family's body all together. So again, guys, doctorswarren.com. This has been Wellness Radio with Dr. Nathan Warren. I'll see you guys next week. See you guys.